Laws governing bone growth. Delpeche. Wherever the diarthrodial cartilages transmit an abnormally decreased pressure, the neighboring conjugating cartilage goes into reverse activity. Wolf. Every change in the form and function of a bone or its function alone is followed by certain definite changes in its internal conformation according to mathematical laws. Other factors that influence bone formation are nutrition, pathologies, hormonal and biochemical factors, trauma, and heredity. Godine. Growth spurts follow each other at approximately 6-month intervals. The growth in width changes with the growth in height. The growth of the distal extremity alternates with that of the proximal. The growth of the lower limbs alternates with that of the upper limbs. Lateral alternation is also observed. The lower limbs have separate growth impulses, the left leg often lagging behind the right. These laws are more clearly observed in adolescence. This fact explains in part the frequency of pelvic imbalances in children. This inequality is not alarming because it is usually temporary. It must be followed up to avoid a permanent scoliotic attitude. Basic astrology. Joints are the junctions of two bones and are divided into 3 basic types. Synarthroses, immobile and have no joint cavity, in which the bones are separated by a thin layer of periosteum as in the sutures of the skull. Amphiarthroses, slightly mobile without articular cavity and the bone ends are separated by fibrous tissue in synsmosis or fibrocartilaginous as in symphysis. Diarthroses, free, have a cavity and are divided into 7 types of joints. They are called synovials. There are several terminology and classifications, but each joint has its own peculiarities. Types of diarthroses. Sliding. Non-axial, allows twisting or sliding. X. Intercarpal. Hinge or gingival. One face concave and the other convex. X. Elbow. Pivot or trichoid. Uniaxial, allows rotation. X. Atlanto-occipital. Ellipsoid. Biaxial, oval, allows flexion, extension, abduction, adduction and circumduction. X. Carpal metacarpal. Bicondylar. Biaxial, spheroid. X. Metacarpal phalangeal. Spheroid or anarthrosis. Triaxial, allows flexion, extension, abduction, adduction, circumduction. And rotation. E. Scapulohumeral. Sellar. 2 saddle-shaped bones fitted together, allows flexion, extension, abduction, adduction, circumduction, and little rotation. X. Carpometacarpal of thumb. Articular structures. Cartilage. The articular or weight-bearing bony surfaces are covered by articular hyaline cartilage, which is elastic, absorbs shock, prevents direct bone wear, and ensures a better fit. These cartilages have no innervation or blood supply of their own. Their nutrition is provided by synovial fluid during movement. The fluid nourishes the cartilage, lubricates the joint, and converts compressive pressure into hydrostatic pressure, which is less damaging to the structures. The amount of fluid is minimal, approximately 2 milliliters, and this creates a subatmospheric pressure that increases joint adhesion and stability. They can take the form of very specialized structures such as the menisci of the knees. Capsule. It attaches firmly to both bones, completely enclosing the joint, and is lined internally by a vascular synovial membrane that secretes synovial fluid into the joint. Some joints, such as the sternoclavicular joint, have a fibrocartilaginous disc that aids the union. Ligaments. These are usually capsule-thickening or cord-like structures that join the 2 bones together, limiting excess range of motion, which creates risk to the integrity of the joint. Another important factor for joint protection is muscle traction, which plays an important role in maintaining joint stability. There is only one position where the joint has its 2 bones touching point to point, called the locked position. All the others are called lax because of the reduction of ligaments.